Hey guys, welcome back to The Buzz. I'm Tiara Bree, and today I'm sitting with Dr. James Hardy of Dr. Hardy Plastic Surgery. How are you doing today?
I'm well, thank you.
Good, thank you for joining us.
Thanks for having me.
So tell me a little bit about your practice. When did it get started?
I started my practice in 2007. We've been doing cosmetic surgery and some breast reconstruction basically since then over the past 10 years.
Awesome. And what inspired you to get into plastic surgery or cosmetic in particular?
Well, I like working with healthy people and making them more beautiful. I also like taking patients that have problems, say with breast cancer, and helping to make them whole again.
That's awesome. So you do that reconstructive surgery for the breast cancer patients. Do they usually
Yes.
come to you from the hospital, or are they recommended, or do you seek them? How does that work?
All of the above.
All of the above?
Yes, so their doctors send them. They also know me from the community, and that's how I get them.
Awesome. And what do people usually come to you most for? Like, what's your top procedure that you offer?
Well, people come to me for cosmetic surgery in general, primarily body-related cosmetic surgery.
Okay.
So that's going to be a lot of breast augmentation, a lot of Brazilian butt lifts and tummy tucks and breast lifts and liposuction, that type of thing.
Awesome. And then where are you all located at?
On Gate Parkway and 9A.
Okay. And then I know you said you try to work with healthy people, but how do you all assess your clients or who you choose to take on as patients?
Well, the way I start every consultation basically is going over someone's health history, and then we start to decide if they're even a candidate for whatever cosmetic operation they want. So we spend a lot of time going through that. I have them go through lab work and see their primary doctor to make sure that they're healthy enough to safely have an elective operation.
That's great that you all look at their health and that background before you just start on the patients. With the weight problems today, do you all do liposuction? Do you work with patients that have weight problems that they just can't control?
Yeah, but liposuction isn't so much of a weight control operation. It's really for correcting areas that are just hard to get rid of on people that are just nice and small, that have a little pudge, and people that are a little bit larger. But you have to be careful about operating on patients that are of a certain size that can increase some of the risk.
I'm sure that can. And working with the healthy patients, I guess that takes down some of the risks most times.
Yeah, the goal is to essentially, you can never totally eliminate it, but to, as close to possible, eliminate the risks to make it, this is fun surgery, so we need to make it very safe.
Good, good. And then so you also offer services to men. What kind of services do they usually come for?
Men usually come for chest operations. So for gynecomastia, which is basically male breast reduction surgery, that's very common. Liposuction is very common in men, and rhinoplasty, nose jobs are very common with men.
Awesome. And then ratio of clients, do you have a higher, percentage of women coming?
I have a
is it
higher
kinda
percentage
easy?
of women.
Okay.
I have a good number of men, but with all the procedures that are done for women, with the breast surgery that I do, and some of the tummy tucks that are related to having babies and mommy makeovers, I tend to have a larger percentage of women.
I'm sure. And so very quickly, walk me through an office visit. If I came in first time, what could I expect?
So you come in the office, you're greeted by our receptionist, and we go over, like I said before, the primary thing is going over your health history, making sure that you're, before we even start talking about any cosmetics, that you're nice and healthy for these type of operations. There are other things that we talk about as well. There are non-operative things that we do routinely, including Botox and fillers and things like that. But we basically go from the health standpoint and then work backward to the desired cosmetic effect. Then we examine and we start the process there.
It's a great order of doing things. I'm glad you all look at the health first. That's awesome. And so if somebody wanted to inquire about your services, how could they get in contact with you?
My phone number is 904-996-0600, and the website is jameshardyplasticsurgery.com.
Well, thank you, Dr. Hardy, for joining us today.
Thank you. It's a pleasure.
Thank you. And thank you all for tuning in. We'll see you next time at The Buzz.